The purpose of this video is to show some of the treatments with direct manual therapy. And if we were to just teach you balance exercises and ankle rehab, we'd have a limited amount of benefit. And it would take a long time. If instead we first restore normal movements in this ankle, then that will greatly facilitate the ankle rehab. And so the first thing that I'm going to do is move that fibula back up. So I take up the slack in the system and I'm going to do 30 oscillations of superior glide. And I just maintain, I take up the slack and I keep that position of tension. I keep that position of slack being taken up in the system, and then I progressively mobilize that fibula superiorly. And I like 30. For me, that's the magic number. Okay?
Okay.
So now that we have done 30 reps of superior glide, now I take up the slack is taken up freely, and I can spring it. So I'm pleased with that mobility. Now I'm going to look and see if the lateral malleolus springs posteriorly, and in fact it does. Okay? I'm going to look at the fibular head. Let me have you lay on your stomach. And I know the camera view doesn't show it, but I'm just going to be here really quickly. And because that moves, I'm not worried about it. So now lay on your back, please. So I'm going to retest subtalar mobility, and now I can abduct the subtalar joint beautifully.
Wow.
So there's no need for me to directly work on the subtalar joint, and that's why there's a specific sequence of what I do with the foot and ankle, because sometimes when you correct movement in one thing, the rest of the pattern just goes away. Okay? So since I don't have to treat the subtalar, now I can go forth, and I'll be honest with you, that feels a little sloppy. That has a distinctly different feel than this.
Yeah.
So now I'm starting to think, aha, we have some ligamentous laxity in this ankle. And so we need to treat that. And we'll try and treat it with reflexes in case there's some muscle inhibition. But if we find that it is a genuine laxity of the ligaments, it's going to take a longer time to heal. So are you aware, can you feel how this movement is different from this?
Mm-hmm.
Can you describe that to me?
It feels looser, sort of, a little, sort of not in a control, or a little sloppy, I guess.
That's what it feels to me, so that's a very good description. Let's look at your standing balance again, please. So stand on the right leg first.
Now my balance. Okay, there we go.
Okay, so you found your balance. It took you a couple of seconds.
Right.
So now do it on the left side. So
it's better, but it's wobbly. I don't know if you can
better,
see it
but
from
wobbly.
The camera. Yeah.
Very good. Okay. So I'm going to continue filming. Come and lay on your back, please. I'm going to try a reflex treatment. And I stumbled on this. And it doesn't mean I discovered it. I suppose other people might be doing this out there. I simply haven't read about it. Treated myself and had a lax, painful joint. And I treated the joint on the opposite side of the body.
Okay.
And that joint tightened up. The ligaments tightened up, which means that there was an inhibition of muscle tone, of normal resting muscle tone. Okay? And ligaments and muscles do connect. Mm-hmm. That's an underappreciated fact. And if I stress the ligaments on your right ankle, it'll temporarily cut down, reduce muscle tone on that side of the body, but it'll reflexively increase resting muscle tone on the other side. And I call it cleaning the broken record, or rebooting the computer. Okay? So when I grab this ankle and I do a drawer test, I feel a certain amount of movement there. And when I do an inversion stress, I feel a certain amount of movement, distinctly different. This feels solid.
Right.
Okay? So it feels like there's a ligament injury on that side, but what I'm going to do is engage the ligaments and capsules on this side in an inversion direction and anterior glide of that calcaneus. And I'm just going to oscillate this at end range. So I'm trying to engage the type 3 and maybe the type 4 mechanoreceptors that's going to inhibit muscle function to this ankle temporarily, and it's going to increase muscle tone on this side. So now I grab this feels more solid to me.
Yeah, it does.
Okay?
Wow. Yeah.
And I'm going to twist it in this way and give it end pressure, and it feels more solid. At end range it feels more solid, but I feel like there's still more inversion play. So I feel like that was a good experiment.
Right.
But it has limited results. We still need to think about long-term ligamentous healing in this ankle. And it's a nice dramatic demonstration when it works, but it only partially worked.
Okay.
So I think we need to talk about use of an ankle splint that you wear for about 6 weeks, and also do aggressive strengthening, endurance, and balance and proprioceptive exercises on this ankle.
On the ankle, okay.
But just out of curiosity, let's have you stand on that ankle and see what you feel.
Okay. It is better.
Good.
It's still a little wobbly, but it's not as wobbly as it was before.
Yes, yes. Good.
Yeah.
So we'll proceed.
Okay.
And so I think it was partially effective.
Yeah.
Thanks. And I'll stop filming now.